when lives are on the line.
Are there any obvious injuries?
These men and women will risk theirs
The lad who was driving got blood coming out of his face.
to save yours.
RTC truck.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear.
There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The two Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof.
Oh yeah. He's got a big cut to his head.
5 million people rely on them
All right, sorry, sweetheart.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high stakes.
Connor, open your eyes, mate. Connor, open your eyes. Hey, this is Medic 3, we're going to RSI.
High risks.
He's got a significant chest injury and also a potentially significant head injury.
And high drama.
He's got some facial injuries, pelvic pain. He's also got bilateral closed fractures of his humerus.
It's early evening, and thousands of commuters are still heading home from the big cities of Yorkshire. But on the M18, there's been a crash.
2 cars have collided, one of them's hit the central reservation.
Hello, got a doctor here at scene.
Brilliant.
He is breathing, but he is semi-unconscious.
Helimed 99 is being scrambled.
We'll move the APU.
It's a 12-minute flight on a moonless night.
Okay, so set up the whole established. Up we go. I'm on goggles, mate. Okay, coming to the east.
Pilot Lee is using night vision goggles to find the scene.
I think I might be picking up blues now, actually.
They're military spec, developed for the battlefield, but now being used to save lives.
Yeah, that's looking good.
But on the ground, the team must rely on head torches. Two cars are involved. The passenger in the black car is seriously injured.
His chest, he's got him holding his chest like it's in pain.
If you're happy to keep leading in-car stuff, give us a shout if you want anything from us, but otherwise, you're the boss.
Dr. Steve is supervising the medics already treating the passenger inside the wrecked car. He'll take over treatment once he's freed from the wreckage.
Just got one potential patient at the moment. We're going to get him out onto a scoop and then assess him once he's out of the vehicle. If he has got any major trauma needing a trauma centre, then we'll probably onto the aircraft and we'll probably fly him.
The man who was driving the car can only stand and watch.
And was driving along, caught the front right-hand wheel and the right-hand side of the road. The gravel caused it to spin out. After spinning out, the second car came along and T-boned his side of the car.
According to Google Maps, it's 40 minutes to Leeds from here.
At the moment, we're not going to intubate him, he's just a bit quiet, isn't he? If we get onto the police now to think about closing the other carriage out, Lee relocates on, we'll be there in 10.
Can you get some lights, fellas?
We have some lights, please.
Firefighters are close to freeing the trapped passenger.
Okay, we'll go and have a look at him.
He seems to be deteriorating.
Ready, steady, go.
Connor Lond is in a bad way.
Connor, open your eyes. Connor, open your eyes, mate.
He's showing signs of a head injury.
Squeeze my fingers if you can hear me.
He could have a bleed on the brain.
We're on the verge of sleepy bobs here, Sam.
Connor!
Yeah, okay, I'll go get RSI, mate.
Dr. Steve has decided to put Connor into an induced coma.
Hey, this is Medic 3, we're going to RSI. We'll use a parapack off the ambulance, it's going to be lighter and it's here.
Anna, stretch your arm out for me.
Come on, mate, give us your arm.
Stretches your arm out.
Let it go, fella.
Connor is agitated. Anaesthetising him here will prevent this and allow his brain to rest.
Yes, mate.
He's been quite tensy. Can I give him 50 of cat to chill him?
Yeah. Yeah, that's it.
This procedure is designed to slow the damage caused by a brain injury. It's normally carried out in hospital.
Yeah, that fluid's going again.
Cheers, mate. And can we get the 3 lead on him? Whenever you're ready, mate, for that ECG lead.
I've got sharp.
Are we all ready?
Connor will be sedated, then paralysed, and then the team will take over his breathing.
So, I'm going to pop him off to sleep now. 3 mils of fent, yeah. Yeah, can slip that way. Yeah, just crack that open, bud. So we've paralysed him, taking over his breathing now. Okay, you're going to have a first look with the laryngoscope then. A lot of secretions. So I'll take the bougie, pop a little bend on it. Click, click, click. Okay. Down she blows, 25 to the teeth, bougie out. Okay. So expansion of the chest, have we got CO2?
Yeah, it's got a blood pressure, Steve, and it's good.
Initial indications are good. Right, let's get him packed and wrapped.
But there's a problem.
Problem is we wanted to relocate the helicopter to this carriageway, which is obviously shut, but we also legally need the other carriageway shutting off as well, just in case we cause an accident. Certain conversations having to be done to get the relevant police force to shut that bit of road off.
Okay, we'll get that blue blanket out the bottom with Gareth, if we can just get that from underneath him.
Connor urgently needs hospital treatment. It's a cold night, and it's making his condition worse.
And there, it just zips up like a big pizza bag.
The motorway is still open. They are going to have to carry him down an embankment to the helicopter.
Okay, everybody got a bit? Yep. Ready, brace, lift. Okay, good. And we're going to walk down around the far side of the appliance to the steps.
We're going this way now.
Yeah, we're committed. You okay, Hannah?
Yeah, fine.
Good. Okay, we're going to gently pass over the barrier.
Connor's physical condition is holding up well, but until his brain is scanned, the seriousness of his head injury will remain unknown.
Yeah, let's pivot round. Let's rest him on the end. Good.
Can I give you the numbers are good.
Hello, trauma call for you. It's Helimed 99, got a 20-year-old male, appears to be isolated head injury. He has been RSI'd, he's intubated, an ETA of 10 and 15 minutes.
Okay, mate, lifting out of here.
Connor is on his way to the major trauma centre in Leeds, a 30-mile flight. Pilot Lee must take off with only the helicopter's searchlight to illuminate the scene.
Hello, 9 Alpha, hello, 1004. Basic service entry to the zone for the LGI.
It's been a long day.
Another late finish, Dr. Rowe.
76%. Plenty of power. Committed to land. All clear left, please. Clear left.
But since we've taken control of his airway and his breathing, we've managed to control his CO2. He's oxygenating well. I think this is an isolated head. Could even just be a severe concussion, but the way that he was acting on the scene led us to believe he did have some intracerebral pathology, so we've done the right thing here by controlling his airway and popping him off to sleep.
At Leeds General Infirmary, the full trauma team have been called to resus.
This young man is Connor, front seat passenger in a car on the M18. The driver's walked out. Connor's been stuck in. He's not been physically entrapped. He's had decreased consciousness.
The fight to stabilise Connor starts here.
He's had 200 of fentanyl. It was a bread and butter RSI, grade 1.
His condition is unknown. His outlook uncertain.
Radios and lights. Radios are due now. 134585, box 2.
On the roof of Leeds General Infirmary, Helimed 99 has just completed one rescue mission, and now there's another.
Leeds radar, hello, it's Helimed 99 Alpha 5 POB. We're on the LGI at the moment, looking to lift en route westbound for an incident to the west of Hebden Bridge.
Paramedic Pete Valance must find an injured cyclist on a country road.
This from 99, lifters from LGI.
Flying Doctor Paul Onion will take charge of his care.
We're going to a male that's fallen off a cycle. Two broad concerns at the moment from the information we've got. So he's been unconscious and he's now conscious again, but I don't know if he's confused or fully conscious. So there's always a risk that if you've hit your head quite hard, you can have some bleeding around the brain, you recover temporarily, and then you get much more unwell again. So we need to consider that at all times. Cyclists are very vulnerable. Often nowadays there's lots more people into cycling, they're going at quite fast speed, so sometimes it can be simply the cyclist coming off and making contact with the road or the pavement or stone walls. The other thing is that drivers tend not to see cyclists quite so well, and the risk of the cyclist being knocked off by cars or lorries, there's minimal protection, so they can sustain some quite severe injuries.
We're just trying to assess somewhere to land at the moment. The ground is very slopey.
The accident happened on a steep descent down the side of a Pennine valley.
On the ground, within limits.
Happy?
Yeah, we're good. It's on 10 degrees, but yeah, we're good.
99, we have landed. Clear out, Steve.
Into the 2 o'clock directly.
The team's joining ground paramedics already on the scene.
Hi guys, you alright? Hiya.
This is Stephen. I think Stephen's been coming down the hill. Nobody here was with him, so we don't actually know Stephen, and he's somehow come off his bike. We don't think there's anybody else involved. Stephen's complaining of rib pain, but he's got equal air entry, bilateral at both sides, and complaining of pain around this side, but he's got quite a nasty graze around the area, and he's just started complaining of abdo pain as well.
Stephen Payne is 66. He was on a ride out from his home in Manchester.
Stephen, hello, just keep your head really still while I'm talking to you. My name's Sam, I'm one of the paramedics with the Air Ambulance. Okay? So you've been riding your bike down the hill and you've fallen off your bike, that's why you're in the road, okay? Where do you live? Can you remember? Where's the pain, Stephen? In your chest. Anywhere else that you can think about? In your hand. Just pop your arm down for me just for a second. Just relax that arm down for me, that's it. I'm just going to have a feel of your neck again. Have you got pain where I'm pressing?
No.
Not at the moment, okay. Any pain down here in your back? Can you take a big deep breath in for me? Is that hurting more when you breathe in? Is it?
He's had a head injury. We're worried that he may have got some bleeding around the brain, even though his consciousness is coming up at the moment. So that's the main concern at the moment. And his oxygen levels are quite low, so we need to make sure we're not missing any significant chest injuries, broken ribs.
Stephen's condition could be serious. If he does have a head injury, he needs critical care soon.
Look at me for a minute, I'm just going to shine a torch in your eyes. Open your eyes, can you open your eyes really wide for me? That's it. Okay. You definitely don't take any medication? The pupils are quite pinpoint, Paul.
His eyes could be a vital clue. Pinpoint pupils are often the first sign of a brain injury.
So what we're going to do, we've got a little needle in your arm, we're going to give you some drugs to get your pain under control, get you more comfortable. I'm going to put you on a hard scoop so we can carry you to the aircraft, okay? So it'll be a little bit uncomfortable, but it'll only be for about 20 minutes and we'll just fly you up the road to the hospital. Is that all right? Good man.
Stephen's struggling to breathe. He may have a collapsed lung, what medics call a pneumothorax. Fellow cyclists found him lying in the road.
The guy was on the floor, nobody was supporting his head, so I just supported his head. He had his cycling helmet on. We were just trying to get his name, really, and just where his pain was.
Ready, steady, roll.
Just go with us, sweetheart. Keep your leg down as much as you can, sweetheart.
Okay, ready, steady, roll.
To be honest, mate, if you take it off or whatever, I'm happy with that. So we're still, C-spine protection still, but we'll just go with that because he's got a chest injury, so we don't want the collar pressing on that and making his chest worse. Do one of you guys mind just walking up the traffic? I don't know whether we want to be able to get that ambulance up there. So if you, and whoever's bike that is, do you mind just shifting it over? Is that all right, chaps?
They're going to fly Stephen to the major trauma centre.
Hi, it's Paul on Honeymed 99. Can I give you a trauma pre-alert, please? I've got a 65-year-old male cyclist, been going downhill at high speed, managed to fall off, unclear as to why. We're going to be flying him in. ETA is probably going to be about 30 minutes from now.
Are you all right, Stephen? Yeah. You remember what it says happened him? Can you remember where we're going?
No.
We're going to go in the helicopter to Leeds, okay? It's only going to be about 10 minutes, it's a really short flight. Leeds, yeah.
Leeds.
So the plan is this gentleman's hypoxic, which essentially means he's got low oxygen levels, and we're quite concerned about that at the moment. So we're going to fly him to the major trauma centre, being he's got a significant chest injury and also a potentially significant head injury. Older people can have a significant head injury and bleeding around the brain without us initially realising that, and they can gradually deteriorate. So we're going to fly him off to Leeds General Infirmary now.
He's being driven to the helicopter. There's no time to waste. Stephen is becoming more and more confused.
Do you know your wife's name? How old are you? You're not too sure? You don't know your phone number at home, do you? Can you remember?
Careful, mate.
Yeah.
Careful, stop. Turn in there.
So we're going to pop you in the helicopter, Stephen. It's going to be really noisy, really loud. There might be a bit of vibration, but that's totally normal, okay? So don't worry. You're not going to be able to talk to us because it's so noisy and you've got these head huggers on, all right? Up to Leeds General Infirmary, okay? Because that's the nearest big hospital to where we are at the moment. You're in Hebden Bridge, all right? In Yorkshire.
Stephen's survival is in real doubt. He's being given powerful analgesics to ease his chest pain. He has several broken ribs.
Yeah, just giving him another 1 ml of fentanyl.
You okay there, Shelley?
Cool. I'm afraid.
So Stephen's obviously had quite a big bang to the head. There's a lot of damage to his helmet. He's been locked out at the time. He doesn't remember what's happened, and he's still confused now on scene. So when we've told him the plan, we're going to take him to the aircraft to hospital. 5 minutes down the line, he's forgotten what I've said already. He can't remember it. That's really concerning to me. It shows that he's probably got some bleeding in his head, so he needs to go to the hospital as soon as possible.
Pilot Steve must get his patient to Leeds as quickly as possible.
Take us. Okay, engines both to fly. Alright, and flight, both guarded. Confirmed, doors and harnesses closed, secure on the right. There we go.
The team are discovering the extent of Stephen's injuries.
He's got a massive hematoma on his hand.
Yeah, and his left shoulder's got a bit of road rash as well, and one of his legs.
Inbound to the LGI, confirm.
Hello, 99 Alpha, affirm. Routing direct to the LGI.
He's pretty much fully conscious, and his observations are quite good, but his oxygen levels were very, very low before we put him on any oxygen. So I'm quite worried that he's got a developing lung injury, and lung injuries, especially in the older generation, will always get worse before they get better. So this gentleman will deteriorate either over the next few hours or the next day or two. The other thing we've done is we've given him some quite strong painkiller called fentanyl, that's kind of 10 times stronger than morphine. And that's just taken the edge off of his pain, meaning that if he has got any broken ribs, he's now able to take better medicine and out, which will help his oxygen levels come up. So yeah, he's stable at the moment, but we are concerned about him, which is why we want to get him to hospital as soon as we can.
Helmet 99 Alpha, finals LGI.
Helmet 99 Alpha, thank you. Wind is 24.
Ready, we're just letting it slide around with the wind. Ready to send some control. Helmet 99, landed LGI.
Stephen's heading for the trauma team waiting in resus. His injuries are very serious. The RAF base at Topcliffe is home to Helimed 98, the helicopter that is a daily lifesaver for 40,000 people living in Yorkshire's rugged dales and moors.
Hold comms.
Paramedics James and Ant have an urgent case.
Looks about right. 4141 was set for departure.
Mark is today's pilot.
Any questions, guys?
No questions.
Power's coming in.
The team's heading west.
Head west from 99, we must have from Topcliffe route to south.
They've been called in by a ground ambulance crew, treating a woman at her home in the southern Dales.
The initial call came in as breathing problems. It looks like this patient's had a history of a chest infection. The crew's got there and they've done an ECG on this patient, and it appears that they're having a heart attack. So one of the main arteries that supplies the heart muscle is blocked.
It's a time-critical case. The woman is an hour's drive from the nearest cardiac unit.
Okay, looks like the pitch there.
Yeah, I've got
And it looks like I can see the ambulance.
that. Yeah, the ambulance is there, isn't it? Over the trees, my side.
Roger, so we're LDP. Landing on.
Heart attacks are one of Britain's biggest killers. Victims can go into cardiac arrest without warning. James is going to take over the care of Moya Whiteman.
This patient's just transferred onto the aircraft. I'll give you a shout when lifted.
She was taken ill at lunchtime.
What's your name, love?
Moya.
Moya, so I'm Anthony. If you just come to the side here.
Moya suffers from a serious chest complaint, COPD.
Tighter than a...
It causes chronic breathing problems. Now an ECG trace suggests her life is in danger.
Just bring your legs up.
They're trying to relax their patient. She's a TV soap fan.
Coronation Street's lost, isn't it? It is. You're going to have to get on catch up, Moya. Yeah. I'm sure you'll find it somewhere. I'm sure I will.
Heart attack symptoms in women can be more subtle than in men. They're often ignored until it's too late.
Head right back, that's it, just while we get you in.
They're not classic symptoms for a heart attack, but there are symptoms that sometimes do occur. So in ECG there are a few changes on it that may suggest there's something going on with one of the blood vessels in the heart. Again, it's reasonably subtle, it's not jumping out, but it is there.
Moya's been taken to the cardiac unit at Leeds General Infirmary.
So it's just like a big pair of headphones. Yeah. Bit cold, I apologise.
It's 45 miles from her home.
Okay.
If it is a clot in one of her coronary arteries, obviously speed is of the essence. The quicker we can get there, the better. And the helicopter will get her there in a fraction of the time that a road ambulance will.
Okay, coming up into the hover, we are 101 below the blue, 2 greens, 0-0.
Moya has been hooked up to the helicopter's state-of-the-art medical monitoring system.
This patient's got quite a history of shortness of breath, being on antibiotics, but she's developed some chest pain as well, which may well be associated to the breathing problems he's had.
If she is suffering a heart attack, she could go into cardiac arrest at any moment.
People can have heart attacks and not be aware of it, and the only way that we find that out is by a blood test. So there's a whole range and scale of different symptoms that people can present with, and as I said, in this particular case, some of them can be masked by breathing problems and certainly chronic breathing problems such as a chest infection.
Her existing health problems make Moya's case a complex one. Specialists are awaiting the helicopter's arrival in Leeds.
Head from 99 on approach LGI.
Moya has been booked in for a procedure to open out blocked arteries within the next hour. But first, doctors must confirm her heart attack. It's early morning, and Helimed 99 is circling a road accident on a main route across the North York Moors to the seaside town of Whitby. Below, a farm worker has just made a shocking discovery. A motorist trapped alone and in agony in his wrecked car all night.
Been here 6 hours, so he said. That's what he'd said to Morrison's. How somebody coming from Whitby hadn't seen him. I mean, Dolly Bush hides him coming from Pickering, but coming from Whitby, he'd have thought somebody would have seen him.
For 6 hours, Richard Morley lay badly injured, both arms and his leg broken. They're life-changing injuries. Now paramedic Ant must take over his care.
Guy called Richard come off the road. He can't even remember which direction he was driving.
Yeah.
Injuries at the moment, we think bilateral humerus.
Yeah.
Femur, left femur. Right-sided pelvic pain now.
Right. Yeah. So bilateral humerus, query femur, some pelvic pain.
Yeah.
Which femur?
Left.
Left femur.
A local paramedic began Richard's treatment.
So we came on scene. I found him initially. Looking at mechanism of injury, cars come off, heading southbound towards Pickering, hit the tree, rebounded off the tree and spun round into the field, causing considerable damage to the front of the car.
Richard had been driving home the night before.
Has everyone got a good hand? Yeah. Right, we'll carry on then.
He's been out all night. You get warming blanket and reflector on. What's his name? Richard. Richard, where's the worst of your pain?
Left leg.
In your left leg?
Yeah.
Okay, any pain anywhere else?
Both arms.
The car hit a tree and smashed through a hedge in the dark. It was only when sunrise revealed broken branches that he was found.
My son had come up and come past to the farm, and then it found out when it came out to go to take a bale to cows, he spotted him. But Morrison's had just gone past there, thought they saw something and turned around and come back to him.
Hypothermia has worsened Richard's condition. There are fears he is bleeding internally from a fractured femur or pelvis.
So Richard, are you unable to straighten this leg?
I can't, no, not really.
Is it in your thigh, the pain?
Yeah.
Firefighters have taken 20 minutes to free him.
No, I feel earlier and I couldn't think.
No, he's just not wanting to straighten it. No. Right, so if we're getting scooped off here and get a binder in.
Yeah.
Okay, have we got pelvic binder?
My arm.
Yeah.
I was first on scene. Morrison's utility wagon had spotted the driver had spotted the crash and called it in. Greasy last night, so the road surface slippery. You can see how far into the field he is, and the approach of the road's on a bend. So I can sympathise with the other drivers at dawn, where the light's not so bad. They'd be concentrating on the junction at the Fox and Rabbit, and they've missed him in the field.
There are fears Richard may also have damaged his spine. He's about to be strapped to a rigid stretcher.
You ready? On three.
Yeah, so you ready?
Ready?
Everyone happy?
Yeah. On
okay.
3. 1, 2, 3, roll.
The temperature dropped to 8 degrees during the night. It means giving Richard painkilling drugs is tricky. Blood flow to his skin has shut down.
Where's the worst of that pain?
Left arm, left arm, left arm,
okay.
left arm.
Okay.
Ow, 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 ow.
Right, Richard, as you're laid here now, how much pain are you in?
It's an 8.
So it's an 8 out of 10, is it?
Yeah.
And that's a constant?
Yeah, mostly from the left leg though.
Mostly from your left leg? From your left thigh?
Yeah.
Okay.
Paramedic Lisa thinks she's found a vein to give Richard morphine.
Right, Richard, you're going to feel another sharp scratch.
Right.
Just try relax.
Ant is alerting the Regional Trauma Centre in Middlesbrough.
Sharp scratch.
Top to toe, he's got some facial injuries, he's complaining of some pelvic pain, he's also got bilateral closed fractures of his humerus.
Right, Richard, hopefully we can give you some pain relief now.
Right.
Yeah, we're probably looking at a 20 to 25 minute ETA.
25?
Yeah.
You all right, Richard?
Yeah.
So we're going to give you some morphine now.
Right.
And then we're going to fly you to James Cook at Middlesbrough, OK?
Their patient is still very cold. He's been wrapped in a heated blanket and a thermal bag.
So we're giving him some morphine, giving him an anti-sickness called ondansetron, and some TXA, just because we're querying pelvis, and you can lose quite a lot of blood into your pelvic cavity, so we give him something just to, which sort of interferes with the clotting factors of bleeding, and then the plan's to fly him to James Cook, which is nearest major trauma centre from here.
Yeah. Okay, we're ready?
Yeah.
Yeah, ready, steady, left. All right.
Richard urgently needs x-rays to his broken limbs.
Okay, so we need to go to our right-hand side of the aircraft.
He's being flown 30 miles across the North York moors.
All right, Richard?
Yeah. We'll just do a helipad out here, I'll have a quick look out turn and then depart the same way that we came in.
The aircraft heater has been turned up to the max in the hope of raising his core temperature.
Temperature a little bit low. It's just kind of borderline hypothermic at the moment, but we don't want that to get any worse because that could make his injuries worse. So yeah, we're just flying into the major trauma centre now for further assessment.
In the next few minutes, doctors at the James Cook Hospital will take over Richard's care. He may need emergency surgery. Helimed 98 is racing west over North Yorkshire.
We have been asked to attend a patient who's collapsed in the Yorkshire Dales. They're going down the line that is a AAA, so it's an aortic aneurysm, which is a swelling on your aorta which can leak and sometimes it bursts. If it bursts, it can be fatal quite quickly. So we need to get there as quickly as we can to make sure that the patient is as stable as they can make them.
The patient is at home in an isolated hillside hamlet, more than 1,000 feet up in the fells. Tyrone believes previous surgery on his aorta, the biggest blood vessel in the body, may be a factor.
I wonder if he's had a graft as well, Paul. If he's had a previous rupture, because they pulsate as well, don't they?
Have they said it's pulsing, right?
No, I don't know. He just said it's back pain, but he's got an existing aneurysm, which obviously you have to treat it as.
This could be fun trying to land here, guys. The person that's got this condition, they're not able to walk or anything, are they?
If it is a AAA, no.
Okay.
Low cloud is shrouding the Dales, and pilot Chris is struggling to find a level area to land.
What about, there's a field now that we've just gone over, Chris.
Yeah.
At the top, and I'll just walk down the field.
Flat bit just to our right, coming up to 3 o'clock now.
Yep, got that.
Oh, here's a bit of a... Oh, yes, it's all right.
It's a nice little flat knoll here.
He's touching down on top of a hill. It's an unusual house call.
Hello?
Michael Stevenson is in the care of a local ambulance crew.
So this is Michael. Michael's got a couple of week history of lower back pain, pubic pain on the left side. He's recently been doing some dry stone walling and a bit of gardening.
I think after doing the walling it was...
You started getting a few niggles then, did you? Yeah.
Michael has never let his life-threatening condition cramp his style.
I've always been fit. I've walked over the Himalayas twice.
Oh, have you? Yeah. Fitter than me.
And after I had these 3As, about 4 months afterwards, I walked over Ingleborough.
Oh, did you?
Yeah.
Blimey.
And about 2 months ago, I walked about 9 miles over the moors.
Did you?
About 2 months ago. But
mind you, I suppose you got to walk 9 miles over the moors to get to the nearest shop where you are, aren't you?
So your pain at the moment's 9 out of 10, you said?
Oh, it's
9 plus.
10, yeah.
Yeah.
Can I just have a quick feel of your tummy? Is that all right?
Yeah.
Do you want some gas and air for pain?
No, I'm all right now.
You sure?
It's gone now.
Okay. So that scar on your stomach, was that your hernia repair, or was that your AAA? Was it?
Yeah.
So you can press on your tummy. Is that tender?
No.
No. Is it tender?
Patients with leaking aneurysms can bleed to death internally in minutes. In the Dales, paramedic Paul is with a patient believed to have a life-threatening aneurysm.
How big is your aneurysm, have they said?
5.8.
5.8 centimetres. Can you describe this pain for me?
It's right inside.
Where you're holding it now? In your back or in your stomach? If you want to go back on your side, you're more than welcome to go back on your side if that's comfy.
It's impossible to diagnose a leaking aneurysm accurately without ultrasound or scans, but Paul is concerned.
What's your drive time to the nearest hospital from here?
To Airedale. Airedale's a bit
It's like a muscle spasm.
So the travel time?
It's a 15-minute flight.
Yeah, exactly. So if they're going to ultrasound him ED, and then they're going to have a look at it, aren't they? So I think we'll just fly him to Leeds.
He's calling specialists 30 miles away at Leeds General Infirmary.
We've got a gentleman who has a history of a AAA. He has had pain in his groin and in his lower left side of his back. If it's leaking, obviously he'll need vascular, and I'm concerned that if he goes to Airedale, potentially he's going to need to be transferred or something. So we thought we'd just go straight to yourself, if that's all right.
Michael used to run a major local charity, and he was a founding member of the Prince's Trust.
I did it for 28 years as a volunteer, and when I resigned, the Queen made me a Lieutenant of the Royal Victorian Order.
Wow.
And then before that, I got an MBE. I didn't want any of these things. I'm not a member of the whole Polaris.
In that case then, sir, we have a chariot outside.
Michael's been in the care of local specialists, but he and his wife live a long way from the nearest NHS care.
Airedale is obviously our nearest general hospital, and that's a good hour away, depending on the traffic. And obviously getting up and down the Dale, because it's quite narrow on a busy day, is quite difficult, really.
The team can't take chances with cases like this.
And it's one of the red flags for us with anybody with abdominal pain with an existing history of a AAA, so we're inclined to err on the side of caution and take them across the Leeds to the vascular surgeons there.
Pilot Chris is heading back east. The Air Ambulance is a familiar sight in the Dales.
Michael's doing a very good job out of staying calm and under the fact he's got so much pain. He's a very outdoor type of chap and he's used to having a lot of pain with his history of aneurysms and things like that. So for Michael to complain of pain, obviously he's a little bit concerned in that his pain has increased to such a level where he's had to get some assistance for it.
Michael's been flown from his home in the heart of the Dales to the centre of Yorkshire's biggest city. It's taken just 15 minutes.
All the way, no worries.
In the next 10 minutes, he'll undergo ultrasound scans. He may face emergency surgery.
Topcliffe.
At RAF Topcliffe, Helimed 99 is being scrambled to help an ambulance crew trying to solve a medical mystery.
Okay, brief will be out over the airfield, standard departure heading north.
We've been tasked to a 75-year-old female that's had a fall, I believe from standing, which has landed onto concrete. The crew have got there, they've assessed her, and they're concerned that this lady may well have a fractured skull. So the crews have asked us to attend so we can transfer her up to James Cook to the major trauma centre.
It's a puzzling incident. Falls this serious with no obvious cause are rare.
DCA visual. I'm just going to try and pick out somewhere where we can get through the hedge to get to them.
There's no gates, is there, in there?
No, I can't see any at all. So the best I can do is where that red car's parked at the moment, I can put it down on that corner of this field.
Okay.
And they'll have to relocate by DCA if they want to.
Yeah.
The patient was out walking near Scotch Corner when she passed out without warning. James is taking over her care.
Hi guys. Yeah, you. How are we doing? What story, guys? Why?
She remembers falling. It does sound as though she had at some point a little fainting episode.
Right.
Pamela Mee was with her husband. He's naturally concerned.
Okay.
He's actually felt a bit of a boggy area.
Right.
It could be the symptom of a fractured skull.
Pamela, my name's James, all right? We're going to be taking in the helicopter. We'll just carry on bandaging your head wound. I'll just get a bit more of a brief off my colleague that should come back here and then we'll get you sorted, darling, all right?
Pamela lost a lot of blood until first aiders applied a dressing to the back of her head.
She is on warfarin, and also she has a blown right pupil.
This lady's had an unwitnessed, what we call transient loss of consciousness. So she's gone straight back from what we can gather and not protected a fall, which is unusual because normally if you tripped or fell you'd put your arms out to try and break your fall. So that needs a little bit of looking into. She's got a head injury and the crews have assessed her. They're querying that she may well have some boggy mass. So they were mobilised and really we need to get her to James Cook so that she can have a head scan.
Pamela is anxious.
You frightened?
I need to breathe.
To breathe? Is it anxiety related you have, or do you actually have you got asthma or?
I don't know.
Okay.
It might be my heart, I don't know.
Okay.
They're going to fly her to specialists 20 miles away in Middlesbrough.
She's had a transient loss of consciousness and fallen backwards onto concrete. She's got a occipital stroke left-sided temporal head wound, which the RRVs, when he's assessed it, they've queried that there may be a boggy mass there.
It's a 10-minute flight. Not the way Pamela was expecting her country walk to end.
You good left?
Oh, jet power's coming in.
But James is no closer to diagnosing the reason for her fall.
When we transfer this lady onto the ambulance, I start to get a little bit anxious, complaining of the fact that she struggles with her breathing when she lays flat. It's something that we need to bear in mind on the aircraft because obviously generally patients are laid flat and when they're immobilised as well we need to keep them flat on a scoop for protection of potential other injuries.
She's landing at the James Cook Hospital.
Good left.
Roger.
Pamela wants to know where her husband Arthur is.
Your good man's on his way. He'd already set off. I couldn't grab him to have a word with him. That desperate to be with you. Eh? I don't know.
Together a long time.
Go on then. How many years?
58.
He was there at the time, oh. So you didn't have the pick of the bunch then? He was the only one? Eh?
I proposed.
Did you?
I did.
Oh, very now.
In the next hour, doctors will find out the extent of Pamela's head injury. Determining the cause of her collapse may take longer. University student Connor, the passenger critically injured in a crash involving his friend's car, was lucky to survive the accident.
Connor, open your eyes, mate.
Injuries-wise, I had 6 fractured ribs, a fractured clavicle, I had a fractured pelvis. There were bleeds on the brain. My family were told I had a 20% survival rate, which I imagine was really upsetting for them.
Hey, this is Medic 3, we're going to RSI.
His injuries forced him to delay the final exams for his pharmaceutical science degree.
It's definitely difficult learning to walk again. That was one of the worst things. But to go from what I was, I definitely felt broken emotionally and physically. To become someone stronger, to be healthy again, to be able to walk, to lift weights, to graduate with everyone else, it means the world to me.
Veteran cyclist Stephen suffered a bleed on the brain after his fall in the Pennines, and he broke 7 ribs as well as his shoulder. He's making a slow but steady recovery.
If you just watch your head there, you okay?
Doctors diagnosed a rare cardiac anomaly in the case of Moya, who was not suffering a heart attack. She must now carry an ECG with her everywhere she goes. Trapped motorist Richard needed surgery to fractures to his skull, pelvis and legs, both arms and several bones in his face. He also had a spinal injury and a year later was still unable to walk. He'll need another operation on his arm. Michael, who was flown to hospital with a suspected aneurysm, did not require surgery, and his scare was blamed on too much manual labour. From now on, it's light exercise only.
I'd been building some stone walls around my house, and I think the effects of it, carrying these enormous stones onto the wall, had harmed my muscles and my back. So I think the combination of this and my age and probably overdoing things had brought it all on, you know.
We're going to be taking in the helicopter.
And Rambler Pamela's collapse was blamed on new medication for an existing health condition. She is now back in her walking boots. When lives are on the line,
Are there any obvious injuries?
these men and women will risk theirs
The lad who was driving's got blood coming out of his face.
to save yours.
RTC truck.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear.
There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The 2 Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof.
Oh yeah. He's got a big cut to his head.
5 million people rely on them
All right, sorry, sweetheart.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high stakes.
We're going to need to manipulate that foot a little bit, all right? Your legs, I'll be honest, it's a mess.
High risks.
Update everyone, 2 patients still trapped.
Is all your pain in the lower back?
Yes.
Yeah, have you got your pain anywhere else?
No.
And high drama. Pilot Mark has flown in Africa and endured winter flying to North Sea oil rigs.
Engines both away. Flash like hard.
But every day on the Air Ambulance throws a new challenge at him.
Someone's got an ident on.
Okay, so we're 101 blood blue, 2 greens still now.
Today he must land in the heart of one of the UK's most historic cities.
Headers from 99, we left about 2 minutes ago, we're route towards Yorkshire. We're on our way to York, we've been passed from Topcliffe in North Yorkshire. We're en route to a patient that's been reported to have been knocked down by a bin lorry, and then there's some question whether or not they're then being reversed over for whatever reason. We've just received an update now from the air desks. We've got some crews on scene. Patient's got some leg injuries and possibly a pelvic fracture as well, which obviously, taking into account the forces that's been involved, is not a surprise really.
So see the second of the 2 large green areas, that's the northern school.
I've got the incident.
Mark must get paramedics James and Ant to the scene of the accident, in a residential area of the medieval city.
I can see a bin wagon with its hazards on just over in the grid that we were.
Okay, so it's in the 2 o'clock
visual, in the housing estate,
Yeah.
He's aiming to land in a small park.
I'm looking at this little green area just down here with a Y section in it with a kiddies play park.
Not
offering me much, is it? That's going to be inside my 2D. Okay.
So just coming over the park area now. Yeah. All good this side, plenty of room.
Mark's flying must be inch perfect. The area is just over the minimum size permitted by the law.
You have got room this side if you need.
How much have I got on your side, mate?
Well, there's just the bench, but...
Could I come a metre to the left?
A metre to the left,
You need to watch your tail if you go left because we have got other friends.
Okay, let's try again.
Still clear of that bench.
I think I'm just on.
That's better this side, mate, bare paw.
Yeah, you're good there.
We're down.
James is hitting the ground running.
Hiya, you alright guys? How are we doing?
This is Bob. Is it reversed? It doesn't matter. Come over his leg, driving forward. This gentleman thinks that it was on his leg and on his hips as well. Some mild mid-shaft femur pain.
Okay.
No obvious deformity here.
Good length here.
There.
Just before we cover it. Painkillers wise?
Painkillers, he's had 5 of morphine. We're about to get TXA in just because of the history.
The wound must be covered, but James wants to show hospital doctors its extent.
Is he managing with the morphine or thinking he more?
He's not in a lot of pain, to be perfectly honest.
I'm just thinking we're moving it.
Packaging boxing and get him onto you guys. We just need a box.
Bob Wall is a bin lorry driver. He was instructing a colleague when he was run over.
Hiya, buddy.
Okay.
We're from the helicopter. Yeah. All right, my name's James. We're going to give you some powerful painkillers, all right? We're going to need to manipulate that foot a little bit, all right? Your legs, I'll be honest, it's a mess.
Yeah, I know.
So I'm going to get you some ketamine, all right?
Yeah.
You might feel a bit funny, a bit strange, but obviously we're going to look after you, that's all you need to worry about. Are you normally fit and well?
Yeah.
Any medical problems?
Just type 2.
Type 2 diabetes.
The truck weighed up to 20 tons. Bob faces amputation. The injury has disrupted blood flow below the knee.
He's got a compromised foot, mate. I'm going to give him some ketamine and we'll... Yeah, we just need to be really careful. It's behind knee and everything.
Bit of a degloving injury, innit?
Bob's workmates are understandably concerned, but he's remarkably calm.
Well, I have any trousers to left it keeps up decent.
We'll cover you up, mate, don't worry.
Blankets on, don't worry. What I mean is for when they get to hospital and that.
What?
Jai!
It's not...
Jai!
It's not a fashion show at hospital, mate, you'll be fine.
Jai! Tell Platty I need some work trousers because I'll need something to...
This afternoon?
Yeah.
For when he's dancing later. So like I say, this painkiller we're going to give you is really strong, all right, mate? Because obviously we've got to mess about with your leg a bit.
We've just been doing the bins locally, and as we've been coming down the road, the driver's turned left, and that's when Bob was on the near side, and he's drove over him. He's one for cracking jokes. I think obviously the shock's going to be a big part in that, and the nature of his injuries. But yeah, his person hasn't changed at all. He's still a daft person.
Bob's injury is life-changing, but he's remaining cheerful.
Jai! Take a photograph of the leg.
So good stuff's going in, mate. You might start to feel a little bit funny, ignore all the bleeps and stuff. We are going to look after you, like I said, all right?
Bob's leg has been wrapped in cling film to preserve as much tissue as possible.
There's no obvious fracture that needs... One fracture that needs reducing, is there? It's kind of... But his foot does feel warm to me. It don't look a great colour, does it?
Yeah.
I was wondering if he's got some existing vascular disease.
Bob. All right, buddy. Yeah. Good lad.
Ready, steady, go.
Air desk from Medic 1. To let you know, our patients had some analgesia, leg dressed and packaged. Just going to load him onto the DCA and drive him round to the aircraft, so we'll be lifting probably in the next 5 minutes.
Doing really well, buddy, all right.
He's got quite a severe leg injury. He's broken his right lower leg. He's also lost a fair bit of tissue and skin, so he's going to need some specialist treatment. We're going to take him to one of the major trauma centres. We're just drawing up some antibiotics so we can give him some antibiotics straight into a vein, because he's got quite a nasty open injury. It'll hopefully prevent any infection setting in straight away and help his recovery.
Let's slide a bit more, guys, if we can. Another foot. Perfect, stop. Hello LGI, it's James on Helimed 99, Yorkshire Air Ambulance. Got a trauma pre-alert. The main injury is a significant degloving injury on his right leg. It starts above the knee and it's down to bone and all the way around his tib down to his ankle. Foot appears white but does feel quite warm, so possibly some compromise there. It's difficult to assess an actual pulse and it's not really for manipulating due to tissue loss and degloving currently.
Mark must now reverse the helicopter out of the park. Speed can help save Bob's leg.
It'll be more vertical in then into a VTOL departure. Obviously, obstacles at about 3D, so just keep a good eye out.
Will do.
Any questions, guys?
No, good in the back.
Roger. Power's coming in.
We are at this time quite concerned both from the extent of the tissue damage and also that obviously exposes it to significant risk of infection as well. So we've treated him accordingly. We've given some strong analgesia, some ketamine, so that we can facilitate his transfer as quickly as possible. We've given him some antibiotics and we're taking him to the major trauma centre in Leeds. How far off are we guys, please?
5 minutes.
I'm just going to come off on if that's all right, give him a bit more analgesia.
Yeah, go for it, mate.
Thank you.
500 for the LGI.
He's had 100 a cat, mate.
100.
He's had TXA, hasn't he? Yeah, he's had a bit of morphine and paracetamol before we got there. Yeah.
The 25-mile flight to Leeds and its major trauma centre takes just 10 minutes.
Okay, we're in the descent now. Just past the green building. Appear there.
So are we going to go around them and come in this way? Yeah.
And try and get it into wind as best I can.
Air desk from 99, finals for LGI.
Roger.
Specialist surgeons have been called to resus to assess Bob's leg.
We're off cold and off harness, mate.
Roger, we're down.
99 landed.
We're down, okay. Just feel funny. Alright, it's probably the medication we're giving you as well.
He may face immediate surgery.
So he's off monitor just for a sec. Arms in, boss.
Are we ready? Yeah, ready to steady it, slide.
Big deep breath, Bob. Excellent, thank you.
The extent of his injury and the risk of infection are against him. His outlook is uncertain. British drivers are getting older. The number of people over 90 holding a driving licence has topped 100,000 for the first time, and it's growing. But today, Dr. Neil and the Air Ambulance team are about to come face to face with a forgotten factor of an ageing population on the roads.
Yeah, Roger, there's one resource on just the CS on his own.
The information that's just been updated to us suggests that this is an elderly male driver in a relatively high-speed RTC road traffic collision. He may have suffered a medical event, so for example a heart attack. So until we arrive and make an assessment, we're not going to be entirely sure what has actually caused his problems. It's potentially a very serious job, and as a critical care team we have some interventions that we can bring to the people who have been injured.
Update from scene, everyone. 3 patients, CPR in progress on patient 1, 2 patients still trapped.
The crash has happened near the commuter town of Ilkley.
Oh, that's a bit of a mess. You've got perimeter wires on the road.
Yeah, visual. Stay away, Paul.
Good left.
You're good this side lane. One of the little cars just moved.
Yep.
Landed. For out lane.
Yep.
2 cars have collided head-on. The 90-year-old driver of one has been pronounced dead. 2 people in the other, aged 72 and 69, are badly hurt.
Minor injury, walking wounded.
Well, it's not what it's walked. It shouldn't be walked. It's being immobilised.
It's a driver.
Right, okay.
Paramedic Tyrone is updating the dispatcher.
We've got one fatality, that was the patient who was receiving CPR. We've got one female still trapped in the car with lower back pain. Obviously a high impact injury, and we've got one patient in the back of the DCA that's now, he's walked away from the RTC.
Dr. Neil is going to supervise the care of the female passenger.
On their first assessment, this is an isolated lower back injury, and the other indications are the patient is otherwise all right. But access is relatively limited. The fire service are going to take the roof off the car, give us better access, and then we can get in and do another medical assessment and see how things are.
Firefighters are struggling to reach her. Stephanie Fletcher is being treated for cancer. Now it's feared she has a spinal injury.
Hello, my love. I'm Neil. I'm one of the doctors. Yep. Hello.
Yes, my mate, yeah.
You're better days, haven't you? What's your name? Stephanie. Stephanie, I'm Neil. All right. Is all your pain in the lower back?
Yes.
Yeah. Have you got pain anywhere else?
No. Well, just when I breathe in.
Just when you breathe in?
Yeah.
So we'll get you out and a bit more comfortable in a second, all right?
All right.
I think you're going to be okay. If I push you forward, is that too sore to do that? Because we're going to need to...
Oh, no, please don't do that.
So just bear with us while we give you a bit more of this strong painkiller in your arm, and then with it, the fire service help you out. All right.
Stephanie was on an outing with her 72-year-old husband Frank and their dog when the other car crossed onto their side of the road.
So I'm not immediately concerned. At the moment, she's awake, she's talking to us. Her numbers are relatively normal. She's got quite significant lower back pain, which is preventing her from getting out of the vehicle at present.
Frank is being cared for by a ground ambulance crew.
Hello. 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 Is it Frank? Hi, Frank. Hello. I'm Neil. I'm one of the doctors. Is it your wife who's in the other car? Yeah.
Tyrone must ensure Stephanie's spine is kept rigid.
So just, you're in charge here, okay? Chaps inside the head, so whatever you want to do, just let these guys know on this charge of the head, so you need to sort of log roll a little bit just to get the scoop on.
We do,
yeah?
Yeah.
She's on chemotherapy, and this injury could affect her treatment.
Two vehicles travelling in opposite directions on an A road at reasonable speed, so they both could have been doing legally 60 miles an hour in either direction. Would appear to be the case. The driver of that car has had a medical event and lost control. So the likely cause here is that he's had a medical event, he's collapsed at the wheel, he's had a heart attack or a cardiac arrest. He's not been in a position to slow down at the point of the impact, hence the impact speed's been very high.
Both Dr. Neil's patients are stable, despite the impact. It's been decided a road journey will be more comfortable for them, rather than a flight.
Hi, Margaret. I've called you Margaret because I've just spoken to your husband, but you're Stephanie really, aren't you? Stephanie, how are you doing?
But the injuries they've sustained today may have a devastating effect on their lives. Older accident victims take longer to recover from collisions and more likely to need care after release from hospital. Helimed 99 is starting up for a mission to the Yorkshire Wolds.
Doncaster, probably outbound to the east. And that'll be a V21 departure out of here. All clear right and all clear left, please. Clear on left.
Pilot Lee used to fly for the Army and the police.
Okay, good controls, good.
Now he saves lives for a living.
What's the job? Something falling down some stairs?
Yeah, on a building site.
Flying Dr. Steve has been told the patient has a head injury.
When we arrive on scene, the first thing we're going to make sure is that we're safe. Building sites can be quite dangerous environments to work in with scaffolding, people above you, and work in progress, so bricks and heavy materials moving all around you. So our first concern will be for our safety. Once we're certain of that, then we'll go in, assess the casualty. If it is a significant head injury, we'll have to look at how we can stop secondary brain injury, and that's caused by swelling and lack of oxygen to the brain. So there's some things that we can do as a team to address those. First thing that we may choose to do is sort out the airway and oxygenation by putting the patient under general anaesthetic.
The accident has happened on a new housing estate in the market town of Driffield.
So there is a bit of a building site by the looks of it, just in
Just in the 1 o'clock. Is that an ambulance there by the roundabout? So roundabout and just short of it. Could be, yeah. It's a couple of concrete silos. Looks like there's an ambulance just this side of it. Yeah, the only problem with that is I think it's going to be dusted. Yeah. And that's my concern about loss of references.
Lee knows all about the risks of dust clouds from his days in Afghanistan. They can blind pilots.
Yeah, okay, I'm just concerned about FOD. Yeah. This may be a factor. We'll see how we get on.
He's landing just outside the site.
Okay, is this all right for you? Yeah. Yep. A little bit of a slope, but I'm happy to accept it, Al.
The patient is a construction worker.
Hello there, hiya. Hi Chris.
Hi there, can I
mate?
have some painkillers please?
Oh mate, you remember what's happened to you? Sorry, I'm going to go through a couple of questions, that's all. My name's Daz, this is Steve, he's one of the doctors. Okay, we're with the helicopter.
Chris Hogben was talking to a colleague when he collapsed and plunged 20 feet.
I was up on top of the stairs.
You just took a tumble.
Yeah.
Where's most of the pain now?
In my eye.
In your eye? So if we look at that. Okay, any pain to the back of your head?
Not that I can feel.
Back your neck. Take a deep breath for me.
My neck feels fine.
Deep breath. Does that hurt your chest at all when you breathe?
You what?
Does it hurt your chest at all when you breathe?
No.
Okay.
I'm freezing cold.
Yeah, well, we're going to get you up in.
Freezing cold.
Get you up in a minute. No worries. No pain in your tummy.
No.
Legs moving fine. Just move both legs for me. Sorry, I've got to go through this. Yeah. And you can't remember what's happened at all.
Not really, no.
For Daz and the team, this is a medical mystery. Chris is young and fit. All the tests Daz is carrying out are drawing a blank.
Just open your eye up for me. Just have a look at my eye. You can't open the other one at all.
Well, no, because it's got a bandage over it.
Can you tell me what day of the week is?
Tuesday.
Yeah. Prime Minister at the minute?
Theresa May.
Okay, no.
And Chris is becoming impatient.
It's nothing obvious, mate. I think there's a lot of claret down here, but nothing.
Yeah. It's quite sharp. This is, I think, maybe a tumble
and then kind of. There's witness mark there actually. So he's come tumbling down. He's probably caught it on the. Fainted.
Dr. Steve has considered most of the common causes of collapse. Chris has none of the symptoms.
I'll borrow this hand then, Bud, and we'll pop a drip in so we can give you some good pain.
Pop a little drip into your hand, okay, so we can give you some painkillers. And we'll give you a strong painkiller and stuff. Yeah.
I'll bet you are.
Just chuck us up, thank you. Cheers, thanks. Have you got your trolley and stuff ready? The scoop? Yeah.
Chris's case needs further investigation in hospital.
Despite some worrying features there, he's nice and stable now, so we've got a specialist paramedic here with the rapid response vehicle who can accompany you into Hull. It's about 20 minutes by road here. One of the important things we can deliver as a team that looks at a lot of trauma is seeing which we do need to convey and which we don't, and with this one, Darren's done a really good assessment. We've assessed him to be stable, so he'll go by road, and it's freeing up the aircraft for any other jobs that may come in Yorkshire. Until that time, we'll give through a hand getting him packaged and ready. Your pain now still 7 out of 10, is it, Bud?
The only clue to the cause of Chris's collapse is a recent visit to the doctor, who diagnosed him with anxiety. He's now on his way to neurologists for further tests.
Okay, there we go. It wraps up like a turkey for Christmas.
The injuries to Chris's head will be x-rayed, but the signs are they're superficial.
We can lift it on. With his head stable, isn't it?
Okay. You're called down.
Okay, on move, ready, set, move. Up around that way. And it's just his head we need to block. We get some.
It's hoped specialists will be able to reveal the cause of Chris's sudden collapse. The results will be keenly awaited by him and his rescuers. On an off-road bike track near Doncaster, a teenager's head cam is about to capture a spectacular accident.
My leg's broken! Hang on, mate, hang on, don't move! I think it is, mate, hang on!
Helimed 99 is being scrambled to the rescue.
Lifting. Alcohol TDP, which will be about 180 feet.
Flying Dr. Paul's skills are needed to straighten the 15-year-old rider's badly broken leg.
As you can imagine, breaking your thigh bone can be extremely painful, and we carry some advanced analgesia that some of the road crews may not carry, so we can help with pain relief and try and make this child pain-free and much more settled. You can lose quite a lot of blood into your thigh bone. If this child has lost a lot of blood, we carry blood on the aircraft, which we can always give to them if we need to.
It's feared the boy has shattered his thigh bone.
No age limit on traction splints, is there? I'm aware of.
Not that, man.
Just
Not that I know. Yeah, as long as it fits.
Yeah.
I've put a traction splint on a 9-year-old before.
Pilot Jeff is dropping his medics next to teenage casualty, Charlie Ricketts. He's in the care of a local ground crew.
He's not hurting anywhere else. Pelvis intact.
Yeah.
Chest is fine. Because obviously we've got a collar on because obviously what's happened. But that's his main pain he's got at the minute.
In his thigh there.
He came over this jump and his throttle was stuck open. I think his leg got tangled in the back wheel, so I think it's broken femur.
Paramedic Ant knows straightening Charlie's leg will be agonising.
This pain that's in your leg, obviously we know it's really severe. Looks like you might have broken that.
Yeah,
but obviously you're in an awkward position now, and we're going to have to straighten you up, and we're going to put a splint on your leg. What we're going to do is, the crew are here have given you some good painkillers, but it's not really touching you, is it? So we're going to give you something a little bit stronger. All right. It might make you feel a bit woozy, a bit not quite with it, called ketamine. All right. But it's really good. It wears off quickly, but what it's good at is for giving it you and then straightening you up.
Yeah.
All right. So it might make you feel a bit woozy. I'll let you know when we're giving it you. I want you to think of nice things when I give it you, though.
Yeah.
All right, mate.
Ow!
Roll him over at the same time.
Oh!
You're doing well, Charlie. You're doing well.
Broken shards of bone that were threatening to puncture blood vessels in Charlie's leg are now back in line.
We're going to hospital soon. We've got you straightened up now. Alright, so we're going to pop you on a stretcher and get you warmed up now.
He's definitely got a broken thigh bone, so a broken femur, so we've managed to pull that straight now. He's much more settled. And the next thing is it's quite a cold day today, so we just need to get him nice and warm. So we've got our heating blanket here, electrical heating blanket, and we'll get him wrapped up in the sleeping bag and take him off to hospital. But he's doing quite well at the moment.
Alright, so ready, steady, roll.
Charlie is going to be taken to Sheffield Children's Hospital, 20 miles away.
How you doing, mate? Yeah, no.
Not very good.
So what we're going to do now, Charlie?
Yeah.
Yep, we're going to carry you over to the helicopter, mate.
Ah!
Charlie,
Yeah.
where's that hurting?
My leg.
Your leg, okay. Right, we'll give you some more painkiller.
But the ketamine is still affecting him.
Charlie, it's fine.
There's four of you.
You're doing absolutely fine.
Ah.
You're doing fine. It's just, remember that painkiller I talked about that's going to make you feel really weird?
Sort of.
Yeah, that's all that's happening, okay. There's nothing to worry about. You're just going in it now, Charlie, mate, okay?
Oh!
He needs reassurance.
What are you feeling at the moment? You're feeling a bit anxious. It's just because we give you some strong painkillers to get you in this position. But we've done with all that now. We've finished that. Your leg's nice and straight. We've got you on the stretcher. So try not to worry now.
All the signs suggest Charlie is feeling better. Now his leg has been splintered.
Clear left, mate.
Alright, Charlie. He's holding me hand.
We've pulled his leg into position, which will help with the pain quite a lot. So he's actually kind of smiling at the moment, and he's just giving Anthony, the other paramedic, the thumbs up. So presuming by the thumbs up, he must be doing okay.
I'll come round, I'll just come up then past the inside of these right things on the right hand side.
Yeah.
It's going to be very lumpy down here. Just to let you all know. So that's me decoupled now.
Roger that.
Jeff's landing in a city centre park, the only site available at the Children's Hospital.
99 Wimbledon.
Their patient's worried mum has beaten the helicopter to hospital.
Charlie.
Oh, sorry, is this Mum? Hi, I'm Paul, one of the doctors. Charlie!
Your mum's here.
Charlie, I'm here, baby.
There you go, mate.
I'm alright, darling.
Told you they'd be here. Trying to give Mum the thumbs up just so she knows you're all right. Yeah, good. Good.
Alright.
The only injury that we've found is he's got a broken leg. That's almost certain. I mean, these guys will confirm that with an X-ray. The only reason we went is just to give him some stronger painkillers.
Charlie's heading for X-rays. This could be the end of his high-speed hobby. The Peak District National Park covers nearly 1,500 square kilometres of rugged landscape, sandwiched between urban South Yorkshire, industrial Greater Manchester and the East Midlands. It's a summer playground for thousands.
Good left.
And today, the park is the destination for Helimed 99. The team's heading for a mountainous area near Sheffield.
Could be a good landing this if they're near Blackclough, which is what it was saying.
Sounds ominous.
Yeah.
Dr. Rob knows they may have to hike to their patient.
The aircraft has strict limits on how steep the ground can be to land. I think it's supposed to be 11-degree slope maximum. We probably, often have to land a fair distance away and have been dropped off at the bottom of mountains in the north of England and had to climb sort of 1,500, 2,000 feet with all the kit. It's quite tiring.
Got 3 cars down there, another one to the right on the other side of the road.
One of them looks like it's got high-vis stuff on the back, doesn't it?
Any information about what colour the jackets the patients are wearing?
All they've said is callers near to Woodhead Reservoir, fainted about 1 kilometre in the moor.
Even finding a patient out here is tricky.
Is that someone down there, James? Just
Well,
your
4 o'clock
4 o'clock now.
now 4 o'clock, Chris.
4 o'clock, Chris. Yeah, there's someone laying down.
On the tree line.
Right on the moor there. One person laying down, one person stood up.
They found the hiker, but pilot Chris must land on a steep rutted slope covered in heather and moss.
Just you've got a bit of uneven ground if you go any further. Don't go further left.
No. Yeah, I know.
What about above the guy?
Yeah, I know. I'm just looking for somewhere flat, or ish, relatively speaking.
Good left. NS99 landing team.
Have a look underneath, please,
Yeah,
James.
cracking door, mate. All skids are on the ground, not sinking at the back.
Okay, good. Go for it.
Happy?
Yep, go.
Paramedic Lisa will stand by as Chris shuts down the chopper. James and Rob head off to the patient.
Hello. How are we doing?
All the better for seeing you, as they say. We were walking up here, just strolling up from the bottom down there. You came over giddy, didn't you? Hands were tingling.
Feel your pulse while we're talking, right?
His hands were tingling.
Okay.
And then he just passed out.
Right.
Or just collapsed.
So did he hit the ground? Did he put his arms out to stop him, or did he just go straight down?
Just went straight down.
Roy Branson and his friend Alan Wilmot were looking for a war memorial on the moor. Roy's 78 and fit, despite heart surgery.
So no pains in your chest at all prior to collapse? No? Okay. Just this tingling. And you've had a heart bypass, haven't you?
Bypass in 2000.
Okay.
No trouble ever since.
Okay, all right. Let's get you checked over. Is there any reason why you're still laying in that uncomfortable position? Have you tried to sit up or?
No, he hasn't.
No. Okay.
James is trying to narrow down the cause of Roy's sudden collapse.
My colleague and I were just out for a walk up on the moors here, and he became giddy and passed out. And he's never done that before. I mean, we walked here before. We were here 2 weeks ago, and we couldn't get where we wanted to get because of the weather. So we came back again today, and perfectly weather, no problems at all, no danger, and he just passed out.
And then I stood up.
Roy is a long way from hospital care. He's several miles from a road.
Any chest pain or anything?
No.
Yeah, nothing. Just tingling in his arm, that's it.
They suspect heart trouble, but the ECG fails to come up with any answers.
What's the heart trace now?
The heart trace is better than mine.
Good.
So
there doesn't seem to be any immediate danger.
No, there's nothing immediately that we need to be concerned about. All right. We're just trying to think logistically what's best to get you off the moor.
Yeah.
You happy? Have we got capacity to lift him? We'll lift him to Sheffield.
Roy will have to walk to the helicopter. His symptoms are showing no signs of improving.
Nice and steady, Roy.
Dizzy now.
Oh, yeah.
Try and hold your head up though. That's it. Just try and let things. Just have a minute, because you've been laid down. You were laid flat when we got here, weren't you?
Get you up the hill to the helicopter.
James is alerting doctors at the Northern General Hospital, just 5 miles over the hills.
Hello, it's James on Helimed 99, Yorkshire Air Ambulance. It's just a pre-alert, just to trigger the helipad. This gentleman's not requiring resus. He'll be fine for normal department. Okay, so our ETA to yourself is probably 10 minutes.
So Roy, no fly to Sheffield, all right? So no smoking service. We'll put you some headsets on, and the in-flight meal is limited to water.
Roy's baffled by his collapse.
Brief. Let's rise up gently.
Good left.
In the Peak District, the air ambulance can save lives just by stopping cases like Roy's becoming serious.
We were able to land right by him. Luckily there were no time critical interventions required, but if there were, then we could have extricated him very quickly and taken him to the hospital. It's lucky that we're available today.
After just 3 minutes in the air, Roy is arriving in the centre of Sheffield.
Yep, we're there. We're going to land.
Oh, someone's skirt's blown up.
It's hoped doctors will be able to identify the cause of Roy's collapse. It may take some time to solve his medical mystery. The sun is shining in the Yorkshire Dales, and pilot Chris is heading up into Wensleydale, famous for its cheese and its winding country roads.
It's given us multiple patients, no other details as yet.
So it's up near Hawes, isn't it?
Yeah, just southeast of Hawes.
It'd be fun to find somewhere to land there, guys.
Looks quite hilly.
Yep.
Paramedics Paul and Simon could have their hands full.
So we've been sent to motorcycle RTC. Very limited details at the moment. Some reports of multiple patients. We're hoping to get some update before we get there. It's quite a remote rural area, so the roads can be quite fast. So for both cyclists and motorcyclists, the injuries could be quite severe. Motorcyclists, when they're ejected, and cyclists at speed from their bikes, they can have a number of injuries: limb, chest, pelvis, and head injuries. So it's difficult to know at this stage as to how severe things are, but things can get pretty bad.
So there's the road. Yep.
Not seen an incident.
Oh, here we go.
You got it?
I think so. Just literally down on our right side, there's about 3 bikes pulled in.
Oh yeah.
The fun bit's going to be finding somewhere flat to land, guys.
Okay.
Alright, your RV's about to turn up. Right, to where those group of people, I'm going to bring you up a field further up because it looks better.
Okay. Alright, I need the exercise.
No, hang on. There's a second light in the shadow. Further down from the guys we first saw.
Oh yeah, got them.
Yeah, I've got them. Yeah.
There appears to be 2 separate accidents.
Police have just arrived as well.
Police have? All
Yeah.
right.
Do you want me to stay here, Simon? Just give me a shout what you need.
Yeah, it might be easier. I'll do all the walking, don't worry.
I don't mind coming.
No, I'm joking.
Look, nerves of a race.
You'd win.
Simon's going to have to leg it to his patients.
So we've got a long walk down the hill to the road. Caught sight of the incident. Didn't look like there was much going on, but it's difficult to see. The patient looks like they're in the tree line. Unfortunately, finding a flat place to land around here is quite difficult, which has meant that we've landed a reasonable walk from the job.
Only 20,000 people live in the Dales, but summer brings a huge increase in population. And today's a bank holiday.
The sunny weather does start to attract people out, so it's not uncommon to start seeing an increase in things like motorcycle and cyclist accidents, particularly in these remote areas when the nice weather hits.
2 groups of bikers have been involved in a head-on crash. Tom Grant's foot is badly broken, as is Anthony Snowball's leg.
How you doing? What's your name?
Anthony.
Hello, Anthony. I'm Simon. So, ankle or foot?
Foot, I think. Ankle, both.
Okay.
It's just on top there, but the ankle I can feel it like clicking.
Yeah, no worries. How painful is it right at this minute?
It's not. It's gone down a bit now.
Okay. All right. So, you might have a little fracture in the foot here, but that might be more bruising. The clicking you can feel it is around the back, and I think you've probably got a fracture in your ankle.
Yeah.
All right. It's not big and swollen. It's not grossly displaced, so hopefully it's fairly straightforward. Just a quick update: 2 patients, both with ankle injuries. We've got 1 DCA en route, I understand, and that should be okay for both patients. How painful? Now taking the boot off. How sore is it now? 0 to 10. 0 being no pain. 10.
It's 1 more than it was before you took it off.
Okay. Right.
Yeah.
Do you want some painkillers?
Yeah, won't mind.
Yeah. So pop a little needle in the back of your hand. We'll give you some morphine. Make it comfortable. All right. So you can have a reasonable journey to hospital.
Anthony's lower leg was crushed between the two bikes, and he may require surgery.
Okay. So I'm just going to go in the back of your hand. Okay. Got a scratch coming. Well done. All over.
Very glad you cleaned your stove last night, so are you? Beautiful, them, Anthony. Use scissors or clippers?
There was no avoiding the collision.
Well, we were coming down past the pub, you know, quite slowly really, and then caught my leg between my bike and his, and then I think he hit the bike behind me as well, so there were not really anywhere for us to go apart from into ditch. And we're purposely taking it steady, you know, nobody wants to get injured, do they, but what can you do?
Police are trying to reduce the number of bike accidents involving visiting riders.
We're not going to do anything here and now at the side of the road, but I'll need to get a statement from you at some point. Your case and everything.
Okay.
Any questions?
Anthony and his mates are on a day trip from West Yorkshire.
Bikers, whether it's a cyclist or a motorcyclist, are very vulnerable. Obviously this time of year it's quite hot. You sometimes get people riding bikes and they don't particularly want to wear leathers, which is obviously understandable because they're going to start getting really hot and sweaty. But they do save lives, and obviously these guys are pretty well protected with what they'd got on in the first place.
Both patients are off to Airedale Hospital, and each faces reconstructive surgery.
We're going to need to manipulate that foot a little bit, all right? Your legs, I'll be honest, it's a mess.
Yeah. Doctors were forced to amputate bin lorry driver Bob's leg above the knee. He was placed in an induced coma and later developed pneumonia and sepsis. But he's better now and hoping to be given an artificial leg soon.
But once you're on the trolley, on the stretcher, you'll be a lot more comfortable.
Cancer patient Stephanie, who was on a day out with her husband when their car was involved in a head-on crash, broke 2 vertebrae in her back. As a result, she was forced to stop chemo treatment and, sadly, she died 3 months later.
Where's most of the pain now?
In my eye.
In your eye?
Doctors discovered a rare form of epilepsy was responsible for builder Chris's fall.
Come on then, you. Let's go sit down here, shall we?
I had 3 fractures of my skull, a bleed on the brain, and then the gash all open here and all my eyes was bruised. Luckily I had my hard hat on at the time because the first blow was across the back of my head, but the hard hat took the brunt of it. And then as I've gone and flipped back over, head over heels effectively, that's when I've got the damage on the front of my head.
There she is, a beautiful little girl, eh?
He's now on medication to prevent another episode.
Boom! Gorgeous little girl.
Gorgeous little thing, and I'd never have got to see you, would I? Eh? Gorgeous little girl, aren't you? Yes. It's only when you realise the importance of things like time with your family that makes you realise that, yeah, these things that are put in place to protect us are needed. They really are. So, yes.
And he's very grateful to have survived the accident.
You going to say hello?
This pain that's in your leg, obviously we know it's really severe.
Biker Charlie, injured in a spectacular crash near Doncaster, suffered a broken femur and internal bleeding from a lacerated liver and spleen.
The bike hit the floor and then I got trapped in between the back wheel and all of the impact went into my left femur here and snapped that in half. The back wheel was spinning round and that was sort of spinning around on my stomach area and I think that's what made me have internal bleeding in my spleen and liver, and I also cracked my hip as well, which was quite painful.
He was in a wheelchair for 6 weeks and on crutches for another 6.
Hopefully I should be walking soon, but I'm not allowed to do any sports. Upset about not being able to ride again, but it's for the better really that I don't, because I'm just fed up of being injured, to be honest.
So no pains in your chest at all prior to collapse?
Walker Roy was found to be suffering from low blood pressure, possibly made worse by dehydration.
I remember just seeing a black pattern in front of my face. And I said, what have I done? And Alan said, you've passed out.
He made a full recovery and is now back in the hills.
We repeated the walk and it was a much cooler day. We took exactly the same route and we just yomped across the moor and found the memorial that we were looking for. So that was a really good day.
Bikers Anthony and Tom both needed extensive surgery. Anthony took 3 months to recover from his injuries. Tom had metal pins inserted in his broken foot. Police took no action against either rider.